Let's cover ABGs. We're going to focus on uncompensated, partially compensated, and fully compensated. Just remember, anytime we think about CO2, it'll be considered respiratory. Anytime we see the bicarb go in any extreme direction, it'll be considered metabolic. And I'll show you why. I created a tic-tac-toe method here for you, and I have this chart laid out. So anything on this side of the board will be considered acidotic. Anything on that side of the board will be considered alkalotic. Normal values for pH is 7.35 to 7.45, CO2 is 35 to 45, and bicarb, which is written down as HCO3, it's 22 to 26. So let's look at this problem here. We have a pH of 7.50. This pH falls way past the 7.45 range, safe range for alkalosis. So let's say it's going to be alkalotic. The PCO2 is at 38. It falls within the normal range of the CO2. So let's put PCO2 as normal. And the bicarb, it's at 33. So it's way past the normal range of 26. So let's put it on the alkalotic side right here, okay? So HCO3. And right there we have a tic-tac-toe, right? It's safe to say that this is metabolic alkalosis, right? So is the pH normal or abnormal? It's abnormal, right? So it's on the alkalotic side. Is the bicarb normal or abnormal? It's abnormal, and we placed it on the alkalosis side. CO2 stayed normal. CO2 did not try compensating whatsoever. It stayed within its normal range, so it's safe to say this is an uncompensated, I have the worst handwriting. It's metabolic alkalosis, uncompensated. So CO2 of 50, pH of 7.28, I already see that this is landing on the acidotic side of the board. So a pH of 7.28 is way lower than the 7.35, so it's acidotic. So let's put the pH on this side. CO2 on the 50 side, so it's way past the 45. So let's do PCO2. I already know how to tic-tac-toe there. And the bicarb is at 24. It falls within the normal range. So let's put bicarb normal. The bicarb tried not to balance things out. So the kidneys did not work out whatsoever. So I already know by looking at this, it's acidosis. So pH of 7.28. So this is going to be respiratory acidosis. How do I know it's uncompensated? The kidneys did not try to balance things out. The bicarb stayed normal. It didn't even try. It just stayed in its own range. It didn't try to become alkalotic to balance out that acidosis. That's how you know if it's uncompensated. So let's look at a partial compensation. So here we have a pH of 7.30. By looking at this board, it's way below that 7.35, so it's on the acidotic side of the board. So it's safe to put pH on the acidosis side. My PCO2 is at 55, which is way past the 45 that is normal range. So it's safe to say my PCO2 is on the acidotic side, right? Now my bicarb is at 28. So it's leaning towards the alkalotic side, meaning it's trying to compensate, right? So let's put HCO3 for bicarb on the alkalotic side. Now, is the pH normal or abnormal? The pH is abnormal because it's on the acidotic side. It did not land on normal, which would be in this range right here. So it's safe to say with a pH that's on the acidotic side, a CO2 on the acidotic side, I already know it's respiratory. There was some partial compensation by the kidneys with the bicarb trying to balance things out, but it wasn't enough because the pH remained abnormal. So it's safe to say now that this is a partial compensation respiratory acidosis. Bicarb tried, but not good enough because the pH remained abnormal. So let's look at a fully compensated example. In this example, the pH is going to be within normal range. You know it's fully compensated as long as the pH falls anywhere between 7.35 and 7.45. In the uncompensated and partially compensated examples, pH was always landing in an abnormal side. It was either going to be an acidosis or alkalosis. In this example, pH is at 7.44, so it's within normal range, right? But notice one thing, the pH is leaning towards that 7.45, so I already know we're looking at alkalosis, right? Now let's see the CO2 and the bicarb. CO2 is at 25, it's way below the 35 range, so safe to say CO2, PCO2 is at 25, right? And then the bicarb falls on the acidotic side, but not too far on the acidotic side. So it's at 20. So HCO3. Now, how do we know whether it's fully compensated respiratory alkalosis or fully compensated metabolic acidosis? Well, if the CO2 is at 25 and the least it can be in the normal range is 35, I see that it's 10 points below its normal range. The bicarb, which is compensating, is only 2 points below its normal range. So the way that you can find your answer is the most points wins the battle. So what I mean by that is PCO2 has 10 points, bicarb has 2 points, so it's safe to say in this example this is fully compensated respiratory alkalosis. Okay, pH is normal, but leaning, not abnormal, leaning towards the alkalotic side of the chart that we have here. Hey guys, if you like the video, please like and subscribe. Also share the video, I would appreciate it so that others can see it. If you have any question, anything you need, please reach out. The course is coming along and I cannot wait to share it with you guys. See you.